New South Wales is on the verge of a vaccine milestone. The state is close to 6 million jabs, but there are other numbers that continue to worry health authorities. The disease has claimed 3 more lives, all were in their 80s, and case numbers are only slightly down on yesterday. The state today woke up to even harsher rules and news of a potential super spreader event at a banned church service in Sydney's west. Tim Swanston has this report.
We declare that lockdowns are over in the name of Jesus.
But they aren't. On the eve of a curfew, 60 people were sprung at an unlawful gathering at this Blacktown church. Many here weren't wearing masks.
We've had a few services that we've noticed, and more people than we thought they probably should have had.
30 people were fined. The church was also fined $5,000.
I think all of us feel the disappointment when people just blatantly ignore what's in place.
For the third day in a row, case numbers are above 800. Almost 700 are still under investigation. 3 people in their 80s have died. A man linked to Liverpool's geriatric ward outbreak, a man in Newcastle linked to an aged care home, and a woman at Campbelltown Hospital. It's feared more people could end up in hospital if the Christ Embassy service ends up as a super spreading event.
Blacktown's mayor has called the gathering absolutely disgusting. It also fell on a day when Blacktown recorded 100 new infections. Cases remaining high could prolong the toughest of restrictions, including the curfew, which took effect overnight.
Even though the Premier has said for months on end that curfews don't work, that we understand that it's now here, and we're hardworking Australians in this part of the world, and we'll continue to do the right thing, which the majority are doing.
RBT turned stay-at-home checks. Police are making good on their word and patrolling streets in large numbers. But rule breaking in the east is also taking a toll. 20 people who went to a Maroubra party and 16 of their close contacts have now caught COVID. The uneven restrictions are already being felt across Sydney. New data shows businesses in the east and north have it a lot sweeter than their west and southwestern counterparts.
On a weekly basis, I'll have more than 50 orders just during the week, just for like little things. You definitely feel it. I've got zero, absolute zero.
The lockdown in Sydney's west has been much harder, and those additional restrictions are preventing people from going out and shopping in their local areas.
Time to enjoy the finer things can't come soon enough. Tim Swanston, ABC News, Sydney.
On current vaccination rates, somebody today should have received the 6 millionth jab in New South Wales. It's been a key target for the Premier with a view to triggering at least one new freedom. Let's bring in state political reporter Ashley Raper. Ashley, is there any word on what changes lie ahead?
Not yet, Juanita, and we're unlikely to find out for a few days. One of the options that had been floated is allowing hairdressers to reopen if the hairdresser and client are both vaccinated. And the ABC understands this remains a possible change. This 6 million vaccine target isn't in the National Reopening Plan. It was a target set by Gladys Berejiklian as a way to incentivise people to get vaccinated during the month of August. And then she asked Dr. Kerry, Chant, the Chief Health Officer, and her team to provide advice as to what could change as a reward. Now, that advice hasn't been given to the Premier yet, but Dr. Chant has previously said that any recommendation from her would be minimal change, and that was before case numbers entered the 800s.
And Ashley, parents are desperate to know when school is going back. Did Dr. Chant give any hint about that today?
Dr. Chant fronted a budget estimates hearing today, and when asked by New South Wales Upper House MPs when students would be returning to school, she said it was too early to say, but did link it to children being able to access vaccines.
It's pleasing to know that the vaccine, ATAGI is currently considering vaccination for 12 to 15-year-olds, and it's quite pleasing to know that Aboriginal children over 12 are eligible for the vaccine, as well as children that have underlying health conditions. So that will be a factor that really influences the safety of school settings, as will be the case burden we have at that time.
It's unclear whether the government will wait for more students to be vaccinated before a full-scale return to school. But Juanita, the Premier has promised to unveil a plan by the end of the week.
Ashley Raper reporting there. Case numbers continue to rise in many regional centres. Jake Lapham is live for us in Dubbo tonight. Jake, authorities are very worried about vulnerable populations in the state's west.
Yeah, Juanita, more cases have emerged in the west and far west. In Wilcannia, there were at least 15 new cases overnight. That means 7% of people in that town have now been infected with COVID-19. In the small town of Gaduga, there were 6 new cases to 8 p.m. last night. But Dubbo continues to dominate the case numbers, and as a result, changes are being made to the health system to cope with an increase in demand. That includes transforming the nearby Narromine Hospital to accommodate COVID patients.
Particularly for patients that might come from some of our northwest rural and remote communities like Cobar, Burke, Brewarrina, Ningan and those type of communities. We know that we're going to need patients closer to our intensive care and highly skilled clinicians in Dubbo.
And Jake, there are new infections popping up in many other parts of the state too.
Yeah, in the Hunter over the weekend, there were pretty positive signs with quite low case numbers, but an outbreak at a Costco construction site does have authorities worried. An infected construction worker from Sydney travelled there to work, and that's led to a cluster of 6 cases. That's prompted calls for more restrictions on construction workers travelling from Sydney into regional areas. Deputy Premier John Barilaro says he'll take those concerns to a crisis cabinet meeting. Juanita?
Jake Lapham there in Dubbo. The number of people with COVID in hospital continues to rise. 586 people are being treated in COVID wards. Of those, 100 are now in intensive care, with 32 requiring a ventilator to breathe. 87% of ICU patients are not vaccinated. Those on the front line are again pleading with people to get vaccinated as pressure builds on hospital staff and families.
We know that it's hard that your families don't get to come in and see your loved ones in the intensive care. Our nurses, who are the backbone of our healthcare system, are providing care that's compassionate. They're holding their hands and they're comforting them because we know that you can't be there.
Over a third of patients in ICU are under the age of 50, including 1 in their teens.